Let's slide over to our state capital, North Carolina's capital, Raleigh, because right now there's a press conference happening. Bear with us on the shot as signal sort of clears up. It's clear now. But pretty much Governor Stein is calling on the General Assembly to reverse cuts to health care by fully funding Medicaid, the Medicaid program. So again, Governor Josh Stein is speaking, urging the General Assembly to reverse the cuts by fully funding North Carolina's Medicaid program. This press conference just started, so let's take a listen in.
Across North Carolina is worried about the potential unwinding of Medicaid expansion and folks exiting the ACA due to loss of subsidies, making the marketplace unaffordable, resulting possibly 700,000 North Carolinians losing their health care. Most of our patients live with 2 or more chronic diseases: diabetes, hypertension, obesity. When they can see a primary care provider, they manage these conditions, they stay healthy, they keep working, and they care for their families. But without routine care, small problems become emergencies. Patients wait until they're dangerously ill, wind up in the ER, needlessly sicker, and far more expensive to treat. The downstream financial impact of this crisis will hit clinics like ours and hospitals very hard. Last year alone, North Carolina's free and charitable clinics saved hospitals across the state $350 million in avoided ER costs and provided $260 million in care value for our state's most vulnerable citizens. Medicaid cuts will erase these savings, drive costs through the roof, and put our neighbors' health at risk. This is not just a financial crisis, it's a human crisis. These are our neighbors, our friends, and members of the community that we see every day, we work with, they take care of our children, our parents, and they have concerning health care issues. Thank you.
Thank you. Good afternoon. My name is Jenna Beckham. I'm a board-certified OBGYN working here in Wake County. Thank you, Governor Stein, for hosting this important conversation, and to the staff and providers here at Alliance Medical Ministry, which provides such essential care to our community, as we just heard. As an OBGYN, I care for patients across their lifespan and in some of the most critical moments of their lives, from pregnancy and childbirth, and including preventive care and management of many chronic illnesses and diseases. Medicaid funding is essential for ensuring access to these services for my patients and their families across the state of North Carolina. Without additional funding, our provider reimbursement rates are set to be cut starting October 1st. These cuts could force many physicians to leave the Medicaid program, which would make it harder for patients to find care when they need it most. If providers exit the Medicaid program, patients will lose access to these things I just mentioned that are so essential: routine exams, prenatal care, cancer screenings, and other essential services. This will lead to longer wait times, delayed diagnoses, and worse health outcomes for the patients of our state, especially for those who live in rural communities and who are already marginalized and underserved. The impact will be most severe for many patients who have complex medical needs, high-risk pregnancies, and our most vulnerable children. Those who are already facing barriers to care will be hit the hardest. Healthcare access should not depend on a person's income or insurance status. As our prior speaker said, this is a human issue and a basic human right. The North Carolina General Assembly must act now. The House and Senate need to return to the table and pass the necessary Medicaid funding to protect access to this care. This crisis is a direct result of failure to appropriate the funding that providers and our patients need. Put the health of our communities first is my ask, and hopefully they can work together to pass funding so that every North Carolinian can access the care that they need and deserve.
Good afternoon. My name is Chelsea Gray, and I am the mom of 3 children. For many parents and caregivers in North Carolina like me, Medicaid is the resource that helps our children grow up to be happy, healthy, and ready for the future. As of January of this year, Medicaid serves more than 1.4 million children across this state. More than 500,000 of these children have special health care needs. 49% of these children rely on Medicaid coverage. Medicaid makes it possible for them to thrive by helping access to therapies, treatments, support services, and their prescriptions that they need to live a healthy life. My daughter, Molly, is living with a medicine-resistant, surgery-resistant, non-curable epilepsy that causes her to have around 191 seizures a day. Every single day, we manage unpredictable seizures, navigate limited treatment options with already slammed doctors, and face a future that feels incredibly uncertain. In a time when it is already difficult to find individuals who are willing to tough this out and do the essential work, I worry about how much more difficult it will to find care for my child and all of the children in this state if Medicaid funding is not protected and provider cuts are put into place. Everyone directly involved with caring for our children, my child, who has a disability, is facing a potential cut. This is not just doctors, it is the home nursing staff. It is also their therapies, their case managers, their OT, their PT, and every single person who makes my child's life happy and healthy. To put this in perspective, as I said, my daughter has 191 seizures a day and it is tracked by a medical device. Yet, some of the appointment times for her specialists are 4 to 11 months currently. Some of her specialists all of her specialists are facing reductions, their current funding, and it will force some of her doctors and other professionals to stop accepting Medicaid altogether, while receiving an overwhelming influx of new patients who are looking for care. The result will be delays in life-saving care for people like my Molly across the state, as well as incredible, unnecessary trauma for families and caregivers statewide. Treating families with disabilities and the people who care for them at every level should be a basic and fundamental expression of human and community care. I am here today to share my story, but not just for my family or my daughter, because we will be affected. It is for every child and every parent in our state. The decisions made here will impact hundreds of thousands of families like mine, families who are simply just trying to keep our children alive and happy. And I fully believe everyone in this room would do the exact same thing. As a parent of a child with complex health needs, every day is already uncertain. It's hard enough to keep them alive and happy. We are barely staying afloat with the funds that Medicaid currently has. So I encourage our lawmakers, and I'm pleading with our lawmakers, to take whatever action is necessary to sustain Medicaid and to relieve the uncertainty that we are facing. I need your support and all of our lawmakers' support to ensure that all of our children are cared for, protected, and able to access the services that they need and deserve. Thank you for your time, and it is my honor and privilege to introduce Governor of the great state of North Carolina, Josh Stein. Thank you for listening.
Goodness. Good afternoon, everybody. I want to thank you all for talking about an issue that is urgent to the quality of care for people's health across the state. I want to thank Pete Tannenbaum and Alliance Medical Ministry for hosting us and for the important work you do in our community to care for people in great need. I want to thank Dr. Jenna Beckham for the work that she does and her willingness to come forward and explain the real consequences of the legislature's failure to act. And most importantly, I want to thank Chelsea Gray. It's not easy to come up here and talk about your daughter's medical needs and put it all out there for the entire state to watch. But her passion for her children and her passion for other children demands that she do so, and I'm incredibly impressed and grateful. Thank you. I want to lay out where we are right now. Everyone, the Department of Health and Human Services, and I'm joined by Jay Ludlam, who directs the state's Medicaid program. Health and Human Services, the state Senate, and the state House all agree that there is not enough funding to maintain the level of Medicaid that we and our people deserve. Everyone agrees that we need to put more money into the program to avoid cuts to provider rates or medical services to beneficiaries. When I say beneficiaries, I'm talking about people all across the state. The House and the Senate each determined that we need $190 million more to keep Medicaid going at its current rate. That's based on an analysis by the Fiscal Research Division of the General Assembly. In fact, each chamber passed a bill this week that would do just that, put $190 million more into the Medicaid system. Even though actuaries and economists at the Department of Health and Human Services have concluded that more than 190 is needed, in fact their number is 319 million, they've found a way to delay any cuts if the legislature will add this crucial $190 million to their budget. The legislative proposals were an encouraging development. I had hope over the weekend that I would have good news and I could issue unfettered praise to the legislature here today. But this week, they did not.
All right, so you're watching there live. That is out of Raleigh, state capitol, where Governor Josh Stein is speaking on the Medicaid program.